Hello, everyone. This is Suzanne Seitz, and I wanted to get this webinar started. I wanted to remind you that this is being recorded, and we are going to email out the full recording to everyone that's registered. If you do have questions that come up during the presentation, please put those into the chat box on your board there, and we will get to those at the end. The presentation takes about 30 minutes, and then we'll have plenty of time to answer questions. So let's introduce ourselves. I'm Suzanne Seitz. I'm a certified genetic counselor. I have been part of the Cryobank for more than 20 years and part of Genetics and IVF Institute, the parent company, for more than 30. So we have a lot of experience in-house on how this all works. Joining us is Christy Burke, who is our Client Services Director, and she's available for questions at the end of the presentation. And then Morgan Barker is our Senior Marketing Manager, and she'll be the moderator for the questions. Let me introduce you to our genetics team. So we are very blessed to have a medical director who's an MD, PhD clinical geneticist. Harvey's been with the Cryobank as our medical director for decades, and he is a wonderful resource. Most gamete banks do not have access to a full-time geneticist. So this has been really wonderful for me as a genetic counselor. Brian Mariani is our molecular genetics director, and we do have an on-site molecular genetics laboratory that does embryo testing and all kinds of genetic testing for our other clients. So he is a wonderful in-house resource. And our founder, Joseph Schulman, is a reproductive endocrinologist, but is also a clinical geneticist. So we've always had genetics in our foundation from the very onset of the company back in the 1980s. And Nadine is our most recent addition. She is a genetic assistant, and she is part of the client services team. She is somebody that you may be talking to if you have initial questions, and she and I work together to address everybody's concerns as quickly as possible. So the goals for today, I want to explain what it means to be a carrier. I want to give you a rundown of all the genetic testing that our Fairfax Cryobank donors have. I want to show you how to use the donor search so that you can find a donor that's suitable for you. And then, of course, we're going to have plenty of time for questions at the end. About 7 years ago, we started doing expanded panel genetic testing. So this is a relatively new service that we're doing on our donors. But it has rapidly changed even since then. We started with a smaller panel and then now are testing for over 500 genes. To keep this in perspective, the human body has 20,000 genes that dictate how it functions. So we're really just testing for a very small subset of what is possible. So the testing today still at 500 is pretty daunting. It is done by gene sequencing, which has the highest detection rates, looking for changes in the gene that could break it and obviously put people at increased risk for disease. A negative result doesn't necessarily mean zero risk, but it does reduce risk. And that's a pretty important concept. A negative result does not mean zero risk, so that's important. When you do expanded genetic panel testing, you'll find that most people, 85% or more, are actually going to test positive for at least one gene on the panel. This goes along with the concept that we're all carriers. We are all healthy carriers of a gene or a group of genes. And that is just the way human beings are designed. By testing 500 genes, most people are coming out as positive. If we could test for all 20,000, all of us would not only be a carrier for one, but possibly dozens of genes. But the important thing is, what's the chance that we would partner with someone and have a child with someone who is also a carrier in the exact same gene? Now, that percentage is very small. It's only about 1%. But those are the group that we're trying to identify so that we can reduce their chance of having an affected child. Once you have a egg source and a sperm source that are both carriers of the same gene, they now have a 25% risk of an affected child. That is the situation we're trying to avoid with all this additional testing. The conditions we're talking about are autosomal recessive. By definition, that means that both the egg and the sperm source are both carriers. Typically, carriers are healthy. They have no symptoms of the disease, but when they go on to create children together, they do have an increased risk for a child that inherits both genes, one from each, and now has no functioning normal component to that gene. So whatever that gene was doing, whatever function it was created to create, whatever it was supposed to do, is now broken, whether it's in the lung or in the heart or the brain. Something is not going to work correctly, and that results in the genetic disease. The chance of a carrier couple, again, this is from the prior slide as well, of having an affected child is 25%. How do we reduce our risks in a pregnancy? Well, if you're a carrier for a specific gene, we want to make sure that the donor is tested and negative. Conversely, if the donor is a carrier for a specific gene, we want to make sure that you're tested and negative. It's important to look at both sides of the equation. I often have people coming in saying, I'm a carrier for these two genes. Is the donor tested and negative? But it's also important to recognize if the donor is a carrier, we have to go back and make sure you've been tested negative for his genes as well. So if you are a carrier, we're going to show you in a step-by-step instruction how to use our donor search to find suitable donors. And if you haven't had the expanded panel done yet, you're not considered a known carrier. So you do have additional options. You can look at any donor on the list, but if you find a donor who's a carrier, you may have to consider doing additional testing. But there are many donors on the list that are not known carriers that you could use. So we'll show you how to identify a carrier versus a non-carrier donor on our search. If you look at the individual page that a donor has on the search, you'll see his genetic testing is at the bottom of the box there, and you can download that. It's a genetic testing summary. Often clinics or doctors will want to see that as part of your selection process for a donor. That's where you're going to find the genetic testing as a downloadable PDF, and you can save it onto your hard drive, attach it to an email, and send it out. This is what it would look like. There's a face sheet, and it has basically a summary of what the donors had done. It will give you the date that this particular sheet was created, which is when was this put together in this format, in this PDF format. It'll give you the ethnicity of the donor, and then it will give you individual lines of what the donor had done, and you'll then see what kind of expanded panel testing, if any, he had done. Just to give you an overview, all donors have had a chromosome analysis done. It's also called a karyotype. This is looking for those 46 chromosomes that we're all supposed to have, where the X and the Y determine our gender. We want to make sure the chromosomes have normal structure. So if there is a missing piece or a rearranged piece, that predisposes an individual to have affected children. So we're going to do this as a way of screening out donors that don't have normal karyotypes. People that are actually missing or have added material here are not typically healthy. But if you have rearranged chromosomal material here, you are at increased risk for creating egg or sperm, depending on your gender, that are unbalanced. And now you have an increased risk for miscarriage and stillbirth and problems in pregnancy. So we want to rule those donors out and not have them be part of our donor pool. All donors have a hemoglobin evaluation. This is a very easy blood test. It's not a genetic test. It's been around for probably 80 years, and it's looking for indicators of blood-borne diseases like sickle cell disease and the two types of thalassemia. But it's a good wellness check. It looks for anemia. It gives us other insight. But certainly the sickle cell, the beta thal, and the alpha thal are also tested on the DNA testing. So this is just another supportive test that we've been doing since the inception of the sperm bank in the 80s. So we've been doing the expanded panel genetic testing for about 7 years. The majority of donors on our list have this testing completed. Keep in mind, there are still donors that are available that are prior to that time. We started with 283, then went to 502 genes. Now we're using an Invitae panel with 514 genes. And you'll see at the genetic testing summary section there that you can see the genes are listed either by gene name or by condition name. It varies between the different testing companies. You'll also recognize that the test you may have had done doesn't look exactly like the test that a donor you're interested in may have had done. This is important because genetic testing panels are not the same. Even the Invitae 514 gene panel and the Semaphore 502 panel, even though those numbers seem to be quite similar, 514 and 502, they're actually discordant by about 100 genes. So it's always important, if one is a carrier, that we actually go into the report and look and see if that gene is present in the other person. So we don't just assume. We're really wanting to see this complete gene list when we're doing an evaluation. A good way to know if a donor has had the expanded panel testing done is if you're just on his donor page, you will actually see this header that says added bonus, this donor is has had expanded genetic testing. And then you'll be able to see down here where his genetic testing is. So that's important for you to know. How do I know if the donor has had expanded panel testing on first sight? That's one way you can do it. Now I want to show you how to do the genetic testing search. So there is this one button here that will expand and give you options for sorting the list. If you want to see all the donors and you don't want them sorted in any particular way, you're going to hit the any box. If you want to see only donors that have had the expanded panel testing done, you're going to click this box. And if you want to only see the donors that have had negative results, then you're going to click this box. Now, keep in mind, I told you that if you're doing the expanded panel, the chance that you're a carrier is 85%. Well, that means only 15% of our donors that have had this testing done are actually all negative. So it's going to be a very small subset of our donors, and they do tend to sell out the most quickly. One of the reasons that is because if you have not had expanded panel testing done yourself, and you don't want to, or you don't have time to, if you use an all negative donor, there are no red flags, and you would be able to proceed immediately. That's a good way to make the process go a little more quickly for you. Now, you can also sort by the genetic disease tested negative, or you can sort by the gene tested negative. So every condition has a name, and then in parentheses, typically near the condition name, you will see capital letters or numbers, and that is the gene name. And so an example would be Tay-Sachs disease, so that's HEXA. This is not always the same across testing laboratories, and the condition name may vary, but the consistent commonality is the gene name. That does not differ between labs. So if you can't find, for instance, phenylalanine hydroxylase deficiency may be called PKU or something else at a different lab, and you think, oh, it hasn't been done. But if you look at PAH as the way to sort the list, you'll find it. I always prefer to use the gene name when sorting the list, but you can try either way. So if you're using the condition name, they're alphabetized, you find it, you click on it, here's biotinidase deficiency, it's going to give you the gene BTD in parentheses afterwards, you hit apply, and then it's going to show you the donors that have tested negative for that gene, all the donors on our list that have tested negative. And you can do the same thing by gene name. You find the gene you want and you hit apply. It's either one or the other. I wouldn't use them both, but you can certainly do that. Now, let's say you don't want to see every single donor that's tested negative. You want the list to be a little bit shorter and more focused on what you want. You can actually pick donors' other traits before you hit submit. And so you can pick on ancestry or education or whether or not they have adult photos available. I often recommend looking at the specimen type and clicking the availability of the vial type that you want so that you're only seeing donors that actually have vials available for sale. And then perhaps having a pregnancy reported is important for you, perhaps CMV status. But you can pick any of the parameters that matter to you And then at the bottom, you'll be able to hit submit, and only donors that meet all the criteria are going to be presented to you, a much smaller, more manageable list. So now you have these donors that you're looking through, you're finding ones that you like. You know, let's say he's negative for this biotinidase deficiency, but you see that he's a carrier for another gene. Well, now it's important for you to recognize that and to see if you yourself have been tested negative for that condition. If you haven't been tested, now you have to stop, because you have to think about what your options are. You can either keep looking and make sure that that you pick a donor that if he is a carrier, you have been tested, or you can consider being tested yourself. Now that's going to hold things up for a little bit. You would have to go back through your clinic to get that testing done. But if he's the right donor for you, I would recommend just going ahead and buying those vials, and I can show you what's involved with that process, getting your testing completed, and then once you're negative, then arranging to have him shipped and used. So when donors are carriers, you'll see obviously they all have this genetic testing, but this acknowledgement of genetic risk is an important part of selecting a carrier donor. Only donors who are carriers have this risk form that needs to be downloaded and signed. You can sign it in one of two ways. You can download it as a PDF, print it out. This is much more complicated, getting that back to us, but there's also a DocuSign option, which can all be done online. This has to be returned to us before we can sell you those files. That is part of the process of getting these files in your name. Let me show you quickly what a standard acknowledgement of genetic risk form looks like. It's going to have a donor number at the top, a list of all the conditions and gene names that he's a carrier for. We're going to recommend that you discuss this donor with your healthcare provider before making a final selection. We want you to acknowledge that that if both biological parents are carriers, there's going to be an increased risk for that disease. And obviously, we would discourage you from picking a donor that's a carrier for the same condition. If genetic counseling or additional genetic testing is indicated, that you recognize that that needs to be completed. Now, the final section here is about the refund policy. We wanted to give you a good stretch of time, 45 days, for you to change your mind. Now, if you purchase a donor and you know there's additional work to be done, either you need to be tested or perhaps the donor needs to be tested, whoever, or perhaps you need your doctor to be able to review the genetic testing summary side by side, yours versus the donor's. You just don't want to lose out on getting those donor vials. We're going to give you some time to work out all those details. The caveat is those vials need to stay in storage with us and not ship, because if they are still stored with us, you have the option for an exchange. So if you prefer a different donor, once you've kind of gone through all the details, we can do an exchange for you. If the new donor has vials that are more expensive, you would be responsible for the additional cost. But ultimately, this gives you several weeks to kind of work out the details. Now, if you decide that you really like a donor and he has not been tested for the gene that you're a carrier for, then we have options available for you. Almost all donors, I can't say every single one, but almost all donors have available DNA on site with us that allow us to do additional testing on him for select genes. We do need to approve the genes that we're going to test, because there are some genes that may be involved with ancestry or adult onset cancer risk and things that we don't typically agree to test for. But if it is one of those recessive, serious pediatric conditions, obviously we want your pregnancy to be as low risk as possible. We'll agree to do that testing. There is going to be an additional fee. We do ask that you own a vial before we get started, because since results can take 4 to 6 weeks, we don't want him to sell out in the meantime. So that once those results come back negative, high likelihood that they'll be negative, we want you to be able to have a vial to use and get started on your cycle right away. You typically coordinate that with the genetic assistant, Nadine or myself, and we can usually get that order placed and started within a few days of you first contacting us. Ideally, I'd like to see your genetic testing results so that I can confirm the gene name for which I'm testing. There are some examples of conditions like, for instance, Zellweger syndrome, where there are 12 or 15 different genes it could be. So I want to make sure I'm testing the right gene because the genes have to match exactly. So you found the donor you want. You're a carrier, but you've confirmed that the donor has been tested and that he's negative reduced risk for that condition. That's a good match. If the donor is a carrier, in addition, you've confirmed that you've been tested for that same gene and been negative. So those are two goes. Those are you can move forward with that donor. Or both you and the donor are not known carriers, so there were no red flags that we needed to investigate. If you all need help in making these final determinations, like I said earlier, these genetic testing results look different across labs. They test for different genes. They have different condition names. If you need help making sure that a donor that you like is suitable, genetically suitable with you, please have your genetic testing results available as a PDF that you can send to our client services team. And have specific donors in mind that you would like me to match those donors to, or your genetic testing to, and then I can get back to you and say, these work, these don't work. If they don't work, why? So that you can consider what your different options are. So once you find the donor you want, the next step is to get those vials ordered. If you're a new client, you're going to have a few additional steps. There is a terms of use that needs to be completed before you can place your first order. You will find that on the website under forms and brochures. Terms of use letter, it's again an online DocuSign. It's very easy to complete, but it is not a 2-minute read. It's important for you to spend several moments going through that page by page so you understand what we're promising you and what we expect from you in return. That needs to be completed. You can finish it and then get on the phone right away with us. We'll find it and make sure that your account is set up appropriately. If you've chosen a donor who's a carrier, then you're also going to need to complete that acknowledgement of genetic risk. Again, as a DocuSign, get that done. And then giving us a call will allow that order to be placed fairly quickly. We encourage first-time clients who are going through this process to call so we can walk you through the process. We want to make sure your account is set up with all the relevant information, that we know which clinic you're working with, confirm an address, perhaps discuss potential ship dates. So we really want to be able to work through those things with you rather than doing it through the online process. But if you've already ordered from us in the past, then you can do all of this online. And we have a nice shopping cart process. You can even schedule storage or shipping through that process as well. So just to summarize, we're all carriers. So being a carrier is normal, but it is important for you to make sure your partner testing is negative so that your child's risk is reduced. You can use the donor search to find a donor that's genetically suitable and confirm his results are obviously a good match to yours. And then once you find the ideal donor, I hope now you know the steps to go through to complete your order. So we do have a promo code that's in effect from now until the end of February that allows you to get a free unlimited access plan. That's a plan that allows you to look at all the donor information for free. I mean, well, there's a one-time fee, and then you can look at all the donors. And that allows you to download the audio interviews, see the adult photos. So it's really a good plan for you to be able to see what's going on these donors. If you were to buy each product individually, you would get over $149 very quickly. So I think now is a good time for us to consider taking any questions that may have come in.
Yep, we already have a few coming in, so we'll go ahead and get started. So one of the first questions, someone asked about the first slide, how it showed a SEMA4 test kit. I thought they no longer did carrier screening. What lab does Fairfax Cryobank use for CS?
Correct.
Carrier screening.
So you're right. SEMA4 We worked with them for about 4 years until they stopped doing carrier testing back in 2022. And so Sema4 no longer offers testing. We moved to Invitae, and we're using the 514 panel with them. That is an all-male panel, so we're only testing for recessive conditions. So that's the group we're using now.
If I tested negative for all genetic testing, does that mean hold on, sorry. It went away, sorry. Does that mean I can select anyone even if they carry a certain gene? What other factors should I consider in selecting a donor? I'm 46 years old and trying to get pregnant with my own eggs.
So, if you're trying to match with yourself and you have been tested with an expanded panel and we're all negative, you really can look at all the donors. The important thing is that if the donor is a carrier for a gene, you're going to have to be able to go back to your own panel and make sure that that gene was on the panel you were tested for. Because like I was saying, the panels are very different. And a gene that is on one panel may not be on another. So all negative does not mean negative for any other gene that could have ever been tested on any other donor. So you can look at them. It's just, you always just have to go back and be able to check your genetic testing. Now, if you're in a situation where you're looking at a different egg source, let's say you consider using donor egg at some point in the future, then it's her panel that you're going to need to compare it to. But right now, since you're working with your own eggs, it's your genetics that's important to compare.
Do you assist with genetic testing for me, or do I have to go through my fertility specialist to initiate?
So we can only do the testing on the donors here. I can make a recommendation as to what testing is indicated, but you would need to go back to your healthcare provider to get the testing, because often insurance is going to cover that for you. So it would need to be done under their guidance. I can't order that testing for you.
And then someone wants to know, what is the fee for me to get the one with the expanded 500 testing?
For them, if you're somebody who wants to get the testing done on yourself, it depends on insurance. Many of the testing labs, if not all, provide insurance. They can tell you what's covered by insurance. Usually a self-pay cost, if you didn't have insurance, is going to be somewhere around $300 to $400 to get a test done, but it depends on the lab. And usually your doctor's office will have one lab that they prefer using, because it's easier for them to have the kits on site just for one lab versus all the labs in the industry that are offering the testing. So again, this is something to ask your provider. But those labs will often work directly with you to tell you what your copay would be or what your self-pay would be if you chose not to use insurance.
And will my doctor be able to test for the individual genes, or is it a whole other panel, a whole panel?
It's easy for me to ask for a targeted gene, a single gene from a lab, but it's something that doctors' offices are often not very, they haven't done a lot of it. I do it all the time, but it is just a matter of talking to the laboratory and asking which requisition needs to be filled out in order to order that single gene. Right now, all of us can go into these online portals and just kind of click the services or the test we want done. So it's just a matter of knowing which box to click, and then they give you the individual genes. It is actually pretty easy to do, but they may need to talk to someone at the lab just to make sure they're doing it correctly, but they should be able to do that. And frankly, I recommend that. If you were to do an entirely new panel because you just wanted the answer on one gene to match with the donor, you may very well turn out to be a carrier for something else, highly likely. Remember, 80% plus chance that you're a carrier for at least something on the panel. Now we have to go back and check the donor to make sure he's negative. Let's say he hasn't been tested for that gene that you're now positive for. So now we're back, we're doing this ping pong effect. It is important, timing is important here, because if you are thinking of using donor sperm and you want all the options available to you, doing the testing before you start looking at donors is ideal, because now you know what you are positive or negative for, and you can try and match with the donor immediately. So I would recommend just doing your expanded panel testing before you start the donor search process, or doing a single gene test so that you match with an individual donor.
The next question, if you're marked as increased risk for a condition in your carrier screening, should you search assuming you're positive?
Yeah, you're probably, there are a few genes like spinal muscular atrophy where the result can show increased risk rather than saying you're definitely a carrier. It gives you this increased number. And they're doing that because they do want you for search process, because if donor sperm lets you kind of look across donors, I would rule out that gene in a donor. I would want him tested negative, reduced risk, because even if he's negative, his risk isn't zero, but we want the risk for your child to be as low as possible. So you certainly want a donor that's tested in negative if you're looking for a gene that you're at increased risk for.
If you need the 45-day hold to get additional testing completed on yourself, is a refund issued if you are in fact positive and not able to move forward with that donor?
Yes. Yes, I mean, you can't use that donor. So obviously you have the option to exchange, or and we would certainly, if you can't find another donor that you like, we would certainly be able to refund those vials. It's not likely that you're going to be a carrier for the same gene that he's a carrier for, but certainly if you identify that risk, we don't want you to use that donor, and we'll do everything we can to either exchange the vials with a different donor or give you a refund.
Does the carrier screening look for repeat expansion disorders? If so, what is the threshold for reporting on those? For example, it says, what if the donor is gray zone Fragile X?
So Fragile X is an X-linked condition, which means it's typically inherited from carrier mothers. And men who have the expansion or have that issue on their X chromosome are typically affected. Almost all of them are affected with the condition. So we do not test our donors for X-linked conditions. We only test them for autosomal recessive conditions where they can be healthy carriers and not show symptoms. So we do not do Fragile X testing on our sperm donors. And that's typically not a gene you test on males who are healthy and show no developmental delay or symptoms of the disease. So we don't have any other expansion diseases, I think, that we test for. There are some that are very rare, but usually the gene sequencing and the other testing we do is enough of a reduced risk to be reassuring. But Fragile X is, any X-linked condition, and Fragile X included, is not tested on our donors.
Okay. Is there a way to filter for vaccinated versus unvaccinated donors? I've looked at donors' Modecle profile, but there's no info on what vaccination they've had or not had.
So if we're talking about COVID vaccine, we do not have any sorting on the search for COVID vaccines. If that's something that's really important to you, we will work with you to gather that information from the laboratory and find out what his vaccination status is. It could be that he's, whatever the situation is on that donor. Usually the labs are obviously very well aware whether or not they've had COVID, if they've had multiple vaccinations, what their status is.
Is there a way to tell if a donor is still donating or not, or willing to continue donating?
So that's not apparent on the donor search. All you see is that a donor is active or inactive. So if a donor is active, that means he still has vials available in quarantine or in inventory for sale. It doesn't tell you whether or not he's still donating. But we have access to that information. So if that's important for you to know, we can research that for you. To bring a donor back is a huge process because they have to be requalified through all the FDA requirements. And Those vials need to be quarantined for a series of 6 months before they can release, and that is a multiple $1,000 process to bring a donor back to donate once you stopped. Ideally, the donor inventory that's available is what is available. If he's still donating, we can tell you that. But if he's close to being sold out, we can tell you that as well.
How closely will my biological sister's genetic screening be to mine? I have a copy of hers, but I haven't had my own done yet.
So you and your siblings share 50% of your DNA, but which DNA it is 50-50. So let's say she's a carrier for cystic fibrosis. Well, you could be a carrier, you could not be a carrier. So I think using your sister's results is not helpful, because you could actually be a carrier for something that she tested negative for. So there are going to be a lot of unknowns there. But, but your original question, you share 50% of your DNA with a sibling.
So, someone wants to know if you could demo the steps to choose donors with the negative 15% testing. And then they want to know what other specifications will be best to have.
So I don't know if I can do the demo. I mean, other than going back to, let's go back to this. So you want to, if you go into this genetic testing search and you hit all negative, if that's what you're asking, I would say there are so few donors in that category. I would just go ahead and click that and see who's there and see if any of them interest you. They may be of an ethnicity or an educational background or have something that would automatically exclude them for you. So maybe you can take a quick look at that group to see if there's anyone there that you like. If you make your additional traits, you just keep checking boxes in the search for other traits that you want your donor to have, you may end up with no donors in your results. So you have to kind of prioritize what's the most important to you. But certainly this extended panel donors all negative is going to be our smallest group of donors.
And then what about, she asked about other specifications that you recommend.
Well, I think that it's important to, if you're going to be looking at donors, find donors that actually have availability today. I would go into specimen type and click the vial type that you need, or if any vial type works, just so that you're looking at donors that actually currently have vials available, so that you can lock down that donor as soon as you make a final decision. It is important for you to know ideally what your CMV status is before selecting a donor. CMV is not genetic, it's not hereditary, but if you have been exposed to CMV, which stands for cytomegalovirus, in the past, you're going to have antibodies and you will test CMV positive. Most people in the US are CMV positive, which means you can use any donor on our list. But if you are CMV negative, which means you have not had a past exposure to this virus that's like a flu, you have not developed antibodies, you and your doctor may have, you need to have a discussion with them about whether or not you have to use a CMV negative donor, but you may, in which case you need to sort out all the CMV positive donors, which is about 60 or 70% of our list. So now you're really looking at a small subsection of our complete donor list, but you don't want to pick a CMV positive donor, go through all of this process of reviewing all this information only to have your doctor say no. So that CMV status is something that comes from your doctor's testing of you before you start the search process. So I would want to know vial availability, CMV status, and then if there's someone you're trying to match to based on skin color or eye color or hair color or height, or ethnicity, those are things, if those are deal breakers for you, I would pick one or two of those criteria and put those in as well.
This one is for you, Christy. How do we know which type of sperm is best to order, IUI versus washed or unwashed, etc.?
Great question. It really will depend on the type of procedure that you're having and if your doctor has a preference. Usually, for example, like an IVF procedure, anything could work, but the main difference that you're going to see when you're looking on the search is IUI, which is pre-washed, and we have premium IUI, IUI art, and we also have ICSI washed. The difference is going to be the amount of sperm in each of those vials. And then we'll have ICI, which is unwashed. We also have that in a premium, an ICI art, and then an ICSI. So in most cases, to break that down, you can use anything usually, but discuss with your doctor. They might have a preference. If you're not sure, contact CS at the phone 1-800-338-8407, and we'd be happy to walk through that with you.
Okay, great. Thank you. Suzanne, back to you. I had a genetic test done 9 years ago with 250 genes. Should I get the 500 one from Invitae now?
9 years ago, a lot of the testing didn't involve gene sequencing, which is a much higher detection rate testing. They used something called genotyping, where they were only looking at specific points in the gene where they knew there were errors, kind of like proofreading, where you know exactly where the misspelling is. So 9 years is a long time. The testing has gotten better. You could have tested negative for a gene 9 years ago, where today you would be positive because the variant's been discovered, the technology's improved. But having said that, if you're looking at donors that have had the best, most recent testing, like the Invitae testing, then as long as one of you has had the higher end testing, then that can be perhaps is enough. It depends on which genes we're looking at. If he's a carrier for something, then perhaps doing a targeted single gene testing upgrade on yours instead of doing a full panel. But 9 years is a long time. I typically say anything older than 5 years should be redone.
Great. The next one, it says, what does PGTA testing pick up on?
PGTA, PG is pre-implantation genetic testing. That's an embryo test. The A stands for aneuploidy. So aneuploidy is any difference in chromosome number, the full chromosome number that would make an embryo less likely to make a healthy baby. So think of Down syndrome as an extra chromosome 21. And so an aneuploid screen of an embryo would allow you to pick up embryos that have either too much or too little chromosome material and not likely become a viable pregnancy. So those are random events. Those are not hereditary events. Those are things that are often associated with advancing maternal age. These are the things you think of when you're over 35 that you keep hearing about, what your increased risk is for. But even in a young, healthy, fertile woman, it's not uncommon for a certain percentage of her embryos, if they were tested by PGTA, to show an abnormal number, 20-30%. So it's very common. And usually those embryos just simply don't continue dividing, or if they are in the uterus, they don't implant, or they miscarry very early.
All right. The next question here for Suzanne. Is there a concern if a donor has a family member with cancer, like a grandparent or an aunt and an uncle?
So all of the family histories of the donors are reviewed by Dr. Stern, who's our medical director and our geneticist. So he's a clinical geneticist. And his goal in reviewing these family histories is to answer the question, is a child from this donor at increased risk based on family history? So it depends on the cancer. It depends on which relative, how far away it is from the donor, Depends on if there's clustering on one side of the family. Some cancers have a stronger genetic hereditary component than others do. For instance, lung cancer is often caused by smoking, which is environmental and not typically hereditary, where there is, on the other side, colon cancer in two relatives on the same side of the family is a concern because colon cancer can be a dominant cancer gene. So we are always evaluating family histories based on what's presented. And so if we vetted that history, we don't feel that the child from that donor is at increased risk over the general population risk for that type of disease. It does matter what your family history is. So if you have a strong family history of a certain type of cancer, or you are at increased risk for cancer based on testing you've had done, or there's diabetes or heart disease, we certainly don't recommend loading it from both sides of the family. So a lot of these conditions are not single gene conditions. Heart disease, diabetes, they're a clustering of genes and the environment working together, and you want to minimize that risk to your child. So know your own family history, and then also look critically at the donor's family history.
Do you make referrals to genetic counselors, or should I just go to my doctor?
I would start with your doctor so that you can ask your specific question of them. A lot of the genetic testing companies that are doing this expanded carrier testing have the ability to answer questions in a genetic counseling session about your results. But they also, your doctor or your clinic may also have a referral network. There are many of these online genetic counseling services where they make a virtual appointment, and then you can discuss your family history concerns. They can address those specifically, even compare your genetics to a donor's genetics and discuss risk factors with you. But that's typically a referral from your doctor's office.
Cool. If the donor is a carrier for a genetic condition, will that health history information be available for their biological child so that the offspring can be tested when they want to, if they want to, and they want to know about their carrier status?
Yes. All of those genetic testing summaries include the actual results. So those can be downloaded as a PDF. We do not take those pages down. So even if the donor sells out and has no more vials left, and it's 10 years ago that we last sold his last vial, you will always be able to access those genetic testing results. And if a donor is a carrier, each of his children have a 50% chance of inheriting that carrier status as well. So that is important information to have. But let's keep in mind a child born today, 20 years from now, when they may be planning their future children, the testing scenario is going to be completely different. They will be able to do testing for probably all the genes at that point. And so what was done now for a few hundred genes is going to be very old school. So my guess is they may know they're at risk to be a carrier for one gene from the donor, but they're likely just going to need to just update testing and find out what all the other genes that they're carrier for as well.
How many tries do I need to have on average to have a pregnancy?
Christy?
I'm here. Great question as well. You guys got some good questions today. It's going to vary. What we will always recommend is to purchase between 3 and 4 vials per pregnancy attempt. And that's something you can discuss with your doctor as well, because there are some factors involved, especially the type of procedure you might be having. Some types of procedures you'll need more vials than others. But I would say on average, you would maybe want to get 3 to 4 vials for maybe 3 to 4 months of trying per pregnancy attempt.
And Christy, while you're here, we have a question about home insemination. Will you ship to my home if I want to do it in a warm, energy-loving environment versus a hospital that's more clinic and sterile environment?
Yes, we definitely can ship to your home. There is an additional document that would need to be completed prior to placing an order to go to your house. You will need to speak with our CS team, either by phone or by email, to get that form. At this point, you're not able to place your order online, but we can definitely assist you, and we do ship to homes.
Thank you. And then the follow-up question to the one about how many vials or how many attempts, how many tries do we need? They want to know how many vials do I need to have per each try, like 2 to 3?
It's going to, that's why we always say, you know, it's good to speak with your medical professional if you're working with one, because it can vary. But I would say for each actual insemination, between 1 and 2 vials. If you're going on the lower end of just the 1, on average, it's totally normal to take 4 months or longer to achieve a pregnancy. So I would say, you know, between 1 and 2 is probably the best, but it can vary. So I would say, you know, as an average, at least 1, obviously, but 1 to 2 per actual insemination attempt.
Okay, great. So I think we have time for a few more questions. If it looks like you have a donor birth limit of 25 per donor, how do you track births? Is it up to the parents to report a birth or not? And also, if at all, do you track when donors have offspring through gamete sales on other banks?
So we do have a limit of 25 families per donor. I'm actually the one in charge of tracking reported pregnancies and births of the donors. We have a very good system of collecting information online from clients themselves. They're self-reporting. Almost all of them are self-reporting through our website or by calling us and reporting a birth. And I monitor that monthly to know, I'm sorry, that was a big loud beep. I monitor that monthly, and if a donor has reached his 25 family limit, he's no longer available for sale to the general public. We do allow additional vials if they're available to increase family size, you know, and in a particular family to have a second child, but not, so, and this is for the US. So the US is a 25 limit. If we're talking about outside the US, we have a limit of 15 additional pregnancies outside the US. And then I monitor that every month. And the other question was, Morgan, what was the other question after family history?
It's about tracking donors who have offspring through gamete sales at other banks.
So we do have a collaborative arrangement with several of the other large banks where before a donor is actually made available for sale, we compare notes and make sure we're not putting the same donors up. So we have a registry where our lab directors are getting together and they input some information about the donor. I think it's a birthday and the last 4 of the social. And if there's a match, we make sure that we don't have the same donors on our sites. And if we do find an overlap from a donor from way back when, we do work collaboratively together to monitor family members.
All right, so the final question that we have time for today is if a condition comes up in multiple donor children, will those who purchase vials be notified?
Yes. So it depends on what the condition is. You know, if it's something that we believe has an increased risk now for other children from that donor, we will restrict that donor from future sales. We will send out a notification to anyone who's actually purchased that donor and make sure they're informed regardless of whether or not they've reported a pregnancy. Each physician or clinic that received one of those vials will also receive a copy of that notification text and a patient list. And then we update the summary profile. That's a good place to look for any new information on the donor over time. We don't actually change profiles. Once the donor goes up for the first time, we don't change profiles. But our summary profile has an update section, so anything new that comes in will end up there. So the donor has provided updates, a child is reported with a specific medical condition, the donor has changed careers. That information is all going to be put in the summary profile. So that's always a good first place to check to see if there's any updated information.
Great. I know there are some questions we didn't have time to get to today, so please reach out to the client services team here using the contact information on the page if you have any additional follow-up questions for them or for Suzanne. And thank you all for joining us.
Thanks you, everybody. Definitely reach out if you have any additional questions.